Alaikum warahmatullahi wabarakatuh. Hello, Joanna Club listeners. The paper I'm about to present is a kind of a continuation, or you can consider it as a part 2 of the previously discussed topic last week presented by my colleague Dr. Jafar regarding the risk of devitalizing vital, sound, normal adjacent teeth that are involved in large periapical lesions after performing surgery. However, in this study, they only included cystic lesions and confirmed it histologically. It's a prospective clinical study by the Italian group led by Erovigni, was published in the IEJ of last month in 2024. The objective of this study was to evaluate the impact of the surgical cyst removal or inoculation on the clinical outcome of the adjacent vital teeth that were confirmed to be involved in the cystic lesion via the cone beam imaging. Included 32 teeth that were in close contact with the cysts in both jaws, maxillary and mandibular, that were equally distributed. The teeth were analyzed by thermal and electric pulp tests before the surgery as a baseline, and 1 week, 2 weeks, 3 months, and 6 months post-surgery, and compared the readings of the electrical pulp tests before and after and looked for any variations. They categorized the teeth to 3 groups, with either having no variations, with some variation of only less than 5 units in the EPT tests, and it was categorized as there is some variation if there was more than 5 unit readings difference. The pulpal necrosis diagnosis was confirmed in the absence of sensation at the highest EPT stimulus levels of 80 readings and repeated 3 times, and they chose to do the EPT test due to its high accuracy in testing vital normal teeth with a high specificity of 93%. They found that from the baseline to the 6 months post-surgically, there was no statistical difference in terms of any pulpal variations in response and sensibility. However, the main significant difference was found at week 1, especially at the maxillary teeth. In the maxillary teeth, the pulp sensibility was initially worsened at the first week before progressively returning and reverting to the normal condition at the baseline at 6 months, while in the mandible, the trend of variation was gradually reverting. There are some suggested theories to explain this temporary phenomena by the Chinese group Liang in 2015, and they observed pulpal vitality complete recovery after removing the compression forces of the cystic lesions from the inferior alveolar nerve, and attributed that to the local neuropraxia that is due to the pressure and tension found on the nerve fibers or blood vessels, which might have caused some local ischemic damage. They recommended not performing what's called in quotes prophylactic root canal treatment for sound vital teeth that are involved in large lesions, but rather to monitor these patients after surgery. The results of this clinical trial suggest that the post-surgical recovery of tooth vitality is possible. Finally, although we obviously cannot draw conclusions from these studies due to the small sample size and the absence of long-term studies, but at least we have some ideas after summarizing some key findings for our take-home message, which are: 1. The risk of devitalizing normal vital pulps of adjacent teeth is relatively low, which is in around 9%. And second, they are usually associated with cystic lesions rather than other type of lesions. Third point is that the non-responsive pulpal conditions are usually temporary, and in most cases will return back to its normal vital conditions, which lead us to the last point of not hastily reach out to a conclusion in making pulpal diagnosis and decide to perform prophylactic root canal treatment, but rather to wait and monitor these teeth for 6 to 12 months at least. Thank you so much for listening. Hope you have a wonderful day. Bye bye.